How's it going, guys? We have a medium difficulty question for Immuno for step 1/endocrine. 33-year-old woman, 5-month history, restlessness, menstrual irregularities, heart rate 90, physical exam shows exophthalmos. We're handing you the diagnosis of Graves' disease. We're not trying to make that hard. That in and of itself is pass level, okay? So Graves' disease, if you do an iodine uptake scan, you're going to see diffusely increased uptake, all right? The mechanism for Graves' disease is you're going to have antibodies, which are called TSI, thyroid stimulating immunoglobulin, that bind to and activate the TSH receptor. Okay, so you have a diffusely increased activation of the thyroid gland. Endogenous TSH would be suppressed. Your T3, T4 are high. Let's just hop to the answer choice here. Choice A, anaphylaxis, wrong fucking answer. It's type 1 hypersensitivity. So you're going to have an antigen such as bee sting. It could be peanut antigen, and it's going to bind to the Fab region of IgE on the surface of mast cells, basophils. IgE are going to juxtapose, cross-link mast cells, basophils degranulate, release histamine, hypotension, swelling. Wrong fucking answer. Choice B, Arthus reaction, wrong fucking answer. It's type 3 hypersensitivity, it's immune complexes. This is going to be, and if you've been following my content, I've talked about this before, this is when you have an injection, such as a vaccination, could be a drug, such as intramuscular ceftriaxone. So you have an injection followed by erythema at that injection site 3 to 7 days later. Okay, so it's not immediate. If it's immediate, that's a type 1 hypersensitivity. If I'm not going to use the word delayed, because when we say delayed, that implies type 4, which is a T cell response. But if you have a slight protraction of time prior to the initiation of the immune response, 3 to 7 days. So the COVID vaccine, Moderna, caused colloquially Moderna arm. So erythema a week later at the injection site. It's immune complex deposition. It's called Arthus reaction. Choice B, wrong fucking answer. Choice C, bullous pemphigoid, correct answer. Type 2 hypersensitivities. It's when you have antibodies directed against your own cells, tissues, receptors. So Graves' disease, as I already talked about, we have antibodies called TSI that bind to and activate the TSH receptor on the thyroid gland. It's type 2 hypersensitivity. So you have bullous pemphigoid. We have idiopathic autoantibodies directed against hemidesmosomes. Specifically, bullous pemphigoid antigen is what it's called, and it shows up in one of the NBME exams written as that, in the basement membrane of the skin, okay? So that's bullous pemphigoid. Pemphigus vulgaris, in contrast, you have antibodies against desmosomes, desmoglian proteins within the epidermis, okay? So past level that you know bullous pemphigoid and pemphigus vulgaris, this question may be a little bit more integration, a little bit more tricky. So type 2 hypersensitivity, pernicious anemia, idiopathic thrombocytopenic purpura, other high-yield heparin-induced thrombocytopenia, other high-yield type 2 hypersensitivities. Let's just whip through the other answer choices here. Contact dermatitis, wrong fucking answer. It's going to be a type 4 hypersensitivity. So this is going to be a T cell response. And this could be classically nickel from the backs of watches. It could be sunscreen. It can be latex allergy. Okay, they tell you a woman working in an anatomy lab, and she's got, or a nurse in a new facility, and she's got diffuse erythema on her hands. Okay, it can be the PPD test with tuberculosis. So high yield poison ivy, oak, sumac, where you have linear rows of vesicles. High yield type 4 hypersensitivities. It's delayed, meaning that doesn't occur immediately. The rash, okay, requires a few days minimum. Wrong fucking answer. Choice C, serum sickness, wrong fucking answer. So this is type 3, same as Arthus reaction. So it's immune complexes. This is classically going to be when you have a drug administered, and then 3 to 7 days later, you get arthritis. Okay, it can also be due to infections, hepatitis B, C, rubella, Yersinia. Wrong fucking answer. You know the deal. I'm just going to make more content like myself. Subscribe my channel. Appreciate your time. That's it.